Welcome to The State of Us.
Beyond mainstream cable news and party lines, with a millennial and a boomer, The State of Us pushes past the noise and uncovers all the issues that matter.
Here's your host, Justin T. Weller.
Large and small hospitals and healthcare institutions are rushing to move doctor visits to virtual settings when possible. What type of lasting impact will this have on the industry going forward? Prior to the pandemic, many large employers were planning on adding on-site therapists. In fact, according to a Wall Street Journal article, 1/3 of large employers, which are those with 5,000 or more employees, were planning to offer on-site behavioral counseling this year, 2020, up from a quarter of those companies in 2019 and less than 1/5 in 2018. That's again, 1/3 of large employers were planning to offer on-site behavioral health. Of course, in the age of the coronavirus, how is this changing? How will they adapt? And what does this mean for the workplace? Those are the questions we're looking at today. But of course, we couldn't begin this critical conversation without
TrueChat senior historian and an educator of more than 30 years. Here is your friendly redneck liberal, Lance Jackson.
So people have been pushing this and the opportunities have been out there for a little while, but now it seems like this is a great opportunity to take a look at some of these teleconferencing and telemedicine and having the people on site. This is a great opportunity to test some of this out and look forward to today's discussion.
It's actually kind of funny, Lance. The first person that I've heard of since the whole coronavirus thing has gotten underway that has had a telemedicine visit is our producer, of all the people. You would think of all of the different people I know, some of whom are perhaps in their more advanced years, you would think that some of them would have had a doctor visit first. But Bradley shared with me that it was not the smoothest experience, but it went okay. It was they got kicked off a couple times. There were some things to work through, but it's also if you don't have to see your doctor in person, it makes a lot of sense right now why you would want to avoid that.
I had a phone conversation with mine, and my daughter's had about, I think, 3 to 5 of these. I can think of at least 3 and maybe a couple more that I have forgotten about. But so I'm a little bit familiar. So she never talked about those things that Bradley did, but I know that it's out there, and I've seen it advertised on television that this is the way you can connect, and seems like a really good thing, in particular in light of what we're dealing with in the current situation.
So a couple of pieces of information, and as always, if you want to follow along and look at this article for yourself, it's at thestateofus.org. This is from the New York Times. They report that telemedicine got an additional boost under the emergency funding measure from Congress. That's $8.3 billion for telemedicine. And it also loosened restrictions on its use to treat people covered under the federal Medicare program. This was something I was speaking with somebody who we know, Lance, that works in healthcare as a nurse practitioner. And she was explaining to me that one of the things that they were, because she runs her own office, one of the things that they were a little iffy about is whether or not insurance companies were going to reimburse the virtual visits, the telemedicine visits, as actual visits, or if they were going to push back and say, well, that doesn't really count because somebody didn't come to your, didn't show up to your office. And I think that's a real concern, especially if you're in an independent practice during this time. If you don't work for a big healthcare institution, if you're providing these visits to people who need them, but you don't get reimbursed for them, there could definitely be a problem there. And I think that's a little bit what we want to talk about is some of the benefits. I think the benefits are pretty clear, right? Which is that especially for high risk people with respiratory problems, people who are older or who already have some kind of immune deficiency, those types of individuals, anytime that they don't physically have to go to the doctor or physically go anywhere, the better. Just
mean like me?
Right.
Sounds like you just described me. Yeah, I know that I've been in contact with my personal physician, and right now I'm knock on wood, healthy for me and healthy in general. But he did say 2 weeks ago when I talked to him on the phone that if I did need anything, we would do it through telemedicine. He has that set up in his practice. Now, I don't know if he has always offered that or not, but he did tell me that he did not want me coming in, if at all possible. You know, he wanted me to stay away and to stay isolated so that I would have the best chance of staying healthy. So I do know that if I do not feel well, that is the direction that I will go, even though I have not had the opportunity to do it myself. Well,
and I think, you know, that is definitely perhaps the biggest benefit of it. But you've been pretty good in general, right, about staying at home, staying away from people, and minimizing that contact with the outside world as much as possible.
I have done that. It's been a lot of a challenge because I didn't realize how, quote, busy I made myself during the day and how many personal interactions that I actually had in person. So it's been quite a struggle, you know, not going to the gas station, not visiting the library, not going to the grocery store. You know, my wife has taken all of that on. And so I pretty much, other than through video calling and conferencing and these kinds of things, how we're doing the show right now, I'm not sure that I've come in contact with another human being other than my wife.
Let me ask you, because I think this is important. I mean, I touched on it before, but, you know, say that you need, to chat with your doctor again or do a visit or something like that, and he wants to do the telemedicine. Put it this way, you know, would you pay the same for that virtual visit as you would for the in-office one?
Yes. I mean, for example, you know, I made a phone call while I was on the road, coming home from someplace before this really started ramping up. And if he were to send me a bill for a visit for our phone call that we had, I would pay it because he performed the same service for me over the phone as if I, you know, for the most part. I mean, he talked to me, he allayed my fears. He gave me information that was necessary. So I think with telemedicine as well, I was thinking about that when you were going through the introduction. If insurance companies are going to do this, it's really too bad, but I guess that's why we have to have government to sit there and tell them, the insurance companies, to go ahead and pay, because a visit is a visit. If you're going to use a professional's time, then you should do this. You know, you should have to pay the same amount of money. The insurance companies should honor this because it's telemedicine. It's still medicine, right? The root word there is medicine. You just did it in a different manner. So the visit still took place. So therefore, it should be the doctors and the healthcare professionals should be reimbursed for their activities.
Well, we know that further action from Congress is almost certain. You know, I mean, we've had 2 or 3 large aid packages so far, and different measures being taken. I think that that's one of those things that they probably need to specify, that an insurer cannot, deny reimbursement to a medical professional solely on the basis of it being a virtual visit as opposed to an in-person one, because I could see that becoming a real problem, especially now, especially for independent people. They're relying on that just like anybody else relies on their job during this time to keep feeding their family. And the last thing you want them worrying about is, well, if I see this patient virtually, am I still going to be able to get paid for that or not?
Well, and that's my point. Is I'm sad that if Congress has to come out and make a law,
you would hope that insurers just do it
because the insurance companies ought to do this without being told to do this.
Yeah,
that's my point. Unfortunately, I think you're probably correct. Congress will have to pass a law that says this counts, but Congress shouldn't have to do that. The insurance companies should automatically reimburse just like they would for an in-person visit. So many insurance companies don't pay for well care. And it's like, wait a minute, you don't want to pay for one doctor's visit that would maybe alleviate lots of problems down the road. So, that's one of the problems that we have with the American healthcare system is that most of them now are starting to come around and have in the last 4 or 5 years, But I remember negotiating contracts for the teachers union where the health insurers would say, no, we're not going to pay for
Right.
WellCare. And it was like, that's counterintuitive to me. Wouldn't you rather pay for health checks?
Especially now with everything that's going on, I think we definitely don't want people to feel like if they are feeling something, if they're experiencing something, you want them to be able to feel like they can get a hold of their doctor, they can talk to them, because the last thing you want is for somebody to not contact their physician if they think there's something going on with them, especially now, because a lot of these things, the sooner you get to them, the sooner we address them, the better chances there are of, you being okay, you recovering. So coming up, we're going to look at a few other items. We've talked a little bit about telemedicine so far. And next, we're going to be looking at this idea of employers offering therapy. Remember, a third of large employers, 1/3, 1 out of every 3 large employers was planning to offer this in 2020. The question is, how does that change in the age of the coronavirus, and what should you be on the lookout for with your mental health right now? Keep it here on The State of Us, and we'll be right back.
We are The State of Us. Here's your host, Justin T. Weller.
According to a survey from the Business Group on Health, nearly a third of employers in 2020 were planning to offer on-site behavioral health counseling. That's up from a quarter of those companies in 2019 and less than a fifth in 2018. So it's been a pretty big increase in just a few years' time. And obviously this is, I think, in response, Lance, to this notion that millennials and Gen Z is obviously just now starting to enter the workforce, while millennials are, making up, they're the largest demographic group in the workforce right now. So, but this is in response, I think, to both of them being more open and more willing. And according to this Wall Street Journal article, quote, younger workers are more comfortable talking about their struggles and expect their employers to take emotional distress seriously. Says a professor of organizational and behavioral health at the Stanford Graduate School of Business. So I think this is, employers are responding to this, and probably it's a net gain. But then you have the coronavirus come along and everybody's working remotely. How does all this change? Do these employers still offer this? Can they afford to offer it in the age of the coronavirus? Can you afford not to? So those are some of the questions I think we have to look at.
Well, I know that I have a family member who works in the mental health area, and they're saying it's amazing. They work for a major hospital out on the West Coast, and their office has just changed dramatically in the last 3 weeks, and the way they see patients and what they're being asked to do are kind of on the line of in violation of the HIPAA laws, and they're being told by their bosses to just disregard those laws because you have to take care of these people.
So how are they seeing patients?
They're being asked to see people who aren't necessarily on their patient list and taking in new patients without going through the usual venting process that takes place. And so then it all comes down to, well, since I really haven't talked to them and I haven't developed a case for them and they're not on my regular caseload, what laws apply? How liable am I for what I try to tell them? Because the system is being inundated with calls with people who want to talk to somebody. And so they're trying to take care of that need, and they don't want to bring people in because of the social distancing and the spread of the virus. And so it's just bringing up a lot of issues for the mental health people, at least as far as this person that I've been talking to, with what they've shared. And they're not sharing a whole lot because that is the state of mental health professionals. By law, they're not allowed to, to share a whole lot. But this concept is very interesting when you think about, especially in working with young people, the number of young people who have, who want or feel the need to talk to someone about their mental health. that having someone there would, I think, alleviate a lot of problems and makes a lot of sense. Plus, when we talked, it's been a few months now, but when we had some of those people on, what is it that young workers are looking for? This is one of those items that they are interested in, much more so than if you would ask somebody like me. Well, you have the opportunity to talk to somebody, people from my generation. I don't think that's, at least for me personally, that's not a big deal.
Because I've debated this some, Lance. I mean, we talk, some of our branding stuff for the show, some of that promotional stuff that people see, even our opening, right? Clearly, makes it clear that you're a baby boomer and I'm a millennial. I wonder when you think about this, is this, because I don't think, and this is part of what it's hard to study because the data is just not really available. So it's, supposition here. And I apologize to our listeners for that. I'm just wondering if other people have thought about this. And maybe I think we can do some study by asking baby boomers. I don't think that it's this generation, referring to millennials or Gen Z. I'm not sure that it's that they have an outsized number of problems. I think it's that there's just more willingness and it's more socially acceptable. We say mental health, and I think, immediately people think about people who have serious mental conditions, that make it hard for them to function as regular members of society. And while naturally that is part of mental health, of course, and part of what these professionals do, for the bulk of it, we're talking about, people who are pretty much everyday people who may not be, they're probably not diagnosed with a personality disorder or anything very serious, but they are more comfortable being open and talking through what they're going through. And I guess that's what I'm trying to figure out is it really that they have more problems and they're willing to talk about it? Or is it really the amount of problems are probably pretty similar? It's just that kind of the mentality I think that maybe baby boomers were raised with was more of a, you figure it out, you get through it, and you just don't, we just don't talk about that type of stuff.
You're starting us to take us down the rabbit hole, but I'll just throw in a third option and people can.
Well, that's what I want. I want to hear what the other,
I guess. But the third side of me is that, and this because I've given you a couple books that I have read that I truly think are right on. And that is with the younger generation, those of us in the baby boomers have, and those a little younger than me, we failed our children as a whole because we haven't given them the tools and the toolbox with which to deal with some of these issues on their own, that we've coddled them and we've protected them from things, thinking we were doing a good job of parenting. And what we've done is not give them the tools with which to deal with these issues on their own. So I'm not
they're seeking
belittling the problems that they have. They're seeking out help where those of us from my generation didn't have to, because we were given the tools by our parents and grandparents to deal with these emotional issues ourselves.
Right. Yeah. It's like a lot of things that we talk about that way, where it's, it's not one, the other, it's a combination of all three items probably. And the big question, of course, is how much of each one is it? I do think, we know obviously that there's that willingness and less societal stigma, which overall is a good thing, because it's kind of like what we talked about in the first segment. If you have, questions or you're concerned about your health, the last thing that we want to do is tell people that they shouldn't seek a professional's assistance with that. But at the same time, it's also some of the things they're seeking assistance for, they might not feel like they had to seek assistance for if they had been provided that through parenting and as they were growing up through, the school system and so forth. So it's a really interesting dynamic, but I think it's neither Lance nor I think we're surprised to see that, because this is just companies responding, to workers' demands. That's one of the things they look for. And when you're in a tight labor market, which was the case, obviously, before the pandemic started, and I'm sure some of that will resume after we get through this, you have to see what you can do to attract employers. And I would think, if I was a big company, Lance, I don't know about you, but right now I would be investing in making those services available remotely, because if you've got your workforce remote, especially if people aren't used to working remotely, there's all kinds of, as I think you're discovering right now, it's very different than when you're going physically into wherever you work. There's definitely adapting to be done, and it varies a lot from job to job. Obviously you teach, so you're very based on, interacting with kids and working with them directly. So maybe some other jobs, not so much, but I know I struggle with, I'm in the studio right now, but I don't know if I would like doing the show from home for an extended period of time very long, just because it's hard. Home is home. At least it always kind of has been. I've tried to make it that way for me, and work is work, and those lines blur on their own. But then when you're trying to work from home, it gets, it can be complicated for people to figure that out. So I would think employers should want to try to make this available as much as possible to their people remotely, because if you want to stay productive, you want to minimize the losses that you're experiencing, you want to make sure that people have the resources they need to make that adjustment and make that transition. And the other thing is, I think everybody thinks of these people as therapists, or at least that's maybe the initial thing that people listening would think. But I think it's important to stress a lot of them will, title these people like life coaches or, resource officers or.
I just read an article this morning. You don't use those two people.
I know.
Don't use those two professions simultaneously, because there are some
they're not
real
the same
dilemmas that are being occurred. Yeah, that are
they're not supposed to be the same
in the workplace, right? People are treating the patients are treating them the same, and life coaches are having to stop and say, "Wait a minute, I'm not a therapist, therefore this conversation has to stop."
Like with most things, it comes back to communications. Employers need to make it really clear to employees what the people they've brought in, are qualified to do, and what is acceptable, and okay to talk to them about. They used on-site behavioral health counseling as the specific indicator for this statistic. So I think that's one of the important things going forward, especially now with remote work. You want to make sure the resources are available, but people have to understand what the resources are. That, like everything else, comes back to clear communication. We're going to look at, coming up, what is the lasting impact of this pandemic. And what I mean by that is, how is this going to play out in regards to telemedicine? How's it going to play out in terms of health counseling, remote work? All of that to come. Keep it here on The State of Us, and we'll be right back.
We are The State of Us. Here's your host, Justin T. Weller.
Hospitals of all sizes and healthcare institutions have rushed to move doctor visits to virtual settings whenever possible. And what we've looked at in the first segment was pretty much that. And in the second segment, we talked some about mental health and how lots of large employers, basically a third of them, were looking to offer behavioral health counseling services in 2020. Of course, in the age of this pandemic, a lot of that has become slightly more complicated. Nevertheless, as Lance and I discussed, probably all the more important, especially with lots of people who never envisioned their job being a remote job, and now in some cases strictly remote, no in-person contact whatsoever. It's kind of, diving in head first here. The big thing that Lance and I discussed a little bit the other day when we were planning this show is, what's this going to do in the long term? Is this going to increase the number of remote workers? Is this going to increase the number of telemedicine visits? On and on and on. And I'll give you, Lance, my 2 cents here, and then you see if you agree with this. I think in regards to remote work, I think what you're going to have is a lot of people very eager to go back to working in person. And I think that will mainly be a reaction not necessarily to remote work, but to not having to be cooped up at home anymore. So I think the initial reaction following all of this, whenever people are allowed to go back physically to work, will be people eager to go back, to get back into the office, to get back to kind of the routine they had before, or at least feel like they're going back to that routine. That said, I think that this is forcing, thousands of employers across the nation to make it so that their workers can work remotely if possible. So I also think that there will be a couple years from now, after we're through the heat of this and things have kind of, fizzled out, I think we'll be back to more employers being open and willing to offer that as an option to workers who want it. So short term, I think people are going to be eager to get back there in person. Long term, I think you're going to have employers shift and say, we spent all this time, we went through the pains of having to figure this out. So if that's something workers want, which we know from that study we had on the program a few months back, that's something, flexible work environment is something that a lot of workers are looking for these days. I think that's what you're going to see long term. In regards to telemedicine, I think that generally speaking, it'll follow probably a somewhat similar course, with the caveat of it'll help people realize that maybe you don't have to spend the time and energy, especially if you're sick, because this has always kind of been a thing. Ill people show up to a place with healthcare professionals, especially if you have the flu or cold or something like that, where there's probably nothing that your healthcare provider is going to do. I think you might see an increase in telemedicine for basic type visits where where there isn't something in person required. You might see an increase in that, especially if people become kind of used to it as this is going on. So there's my 2 cents, Lance. What's your prediction or thoughts on what I said, but also what you think?
Yeah, no, I think the biggest thing with business will be like any change in business that takes place, it'll all come down to if when they run the numbers, it's cheaper to have employees stay home and it's more cost effective, that you'll see businesses start to push this. I'm not sure, kind of in your scenario, you kind of left it up to the worker to decide whether or not they wanted to go back to work or whether or not they wanted to stay at home, and that they would be the driving force to decide how this is all going to play out. And I think it's going to be the other end. I think ownership will decide whether or not they want to do this based on, if it's cheaper for me to have a remote workforce and my profit margin goes up and I can still produce the same things I need to, and I can save money that way. I think that's where the push will come from. If we see any kind of major change, it will come from business and not from workers. This is a conversation that I've had with a couple of my educator friends, and that is, what will be the impact of this on homeschooling? How many students and parents will, after doing this, because basically what we're doing right now in the state of Ohio is 6 to 8 weeks and maybe longer of homeschooling. And if the parents and the children like it, how many students will we lose? That's what I'm interested to see. I don't have a number in mind. I just want to see what's going to happen. So, and that kind of goes along with the workers as well. It's one thing to work from home if your kids are in school. It's another one to work from home if your kids are underfoot and running around and in the background, and you're having to stop and take care of issues of spats between siblings or cooking lunch or all those kinds of things. So I think there's a lot of variables here, but the only thing that I would take, I guess, a little bit of difference is I don't think it's going to be the workers that determine what this will be. I think it'll be the companies. And if the profit margins go up, they're going to encourage people to stay home and work from home. As far as the medicine side of things, I'm all for it. There's not anything, especially as I've gotten older and you have to go to the doctor more, because when I was your age, I never went to the doctor. Just, stayed away from them because sick people went to the doctor and I didn't want to be sick. Didn't have time to be sick. But to have that opportunity to sit in the privacy of my own home and have some things taken care of and not have to go see the doctor, if that's a possibility, I'm all for it. So this is a part of things I think we will see grow in the future, that the telemedicine part will grow exponentially. I really think that'll take place. So there's my thoughts, not necessarily in total disagreement with you. But I think it won't be the workers. It'll be business that drives that part of things.
Shout out to April Jackson, Lance's wife. I think she just made an appearance that unfortunately people couldn't see, but I got to see her. One of those perks, right, of your home
working
studio,
at home.
Lance.
It's like what we said, right? But then we're empty nesters, so we don't have any children underfoot, so it's not
quiet.
But it is interesting that we're both teaching, and we're actually co-teachers. We're co-teaching a class in the building, and now we're having to co-teach at home, and it is a major difference. And somebody said yesterday in a meeting, "Oh, you guys are lucky." And we looked at them and said, "Yeah, well, sometimes."
Yeah.
Everybody always sees the benefits. They don't necessarily see the hardships,
right,
of a situation.
Or they don't want to talk about the hardships if they know they're there.
Oh, we'll gladly talk about the hardships, but it's like the grass is always greener, right? Everybody sees the benefits of a situation they're not in.
So I've got a couple things, Lance. So I think that's interesting, and it made me think about when you were talking about the business side, the employers as opposed to the employees driving the change. I think like we talked about in the second segment, of course, it's always a combination of the two, but then it made me think about when you were talking about education, I wonder if it'll be all that different from that standpoint, because as we look at what does it cost to build these expensive school buildings, to equip them with everything that we need to equip them with, what are the liabilities of bringing all these children in here? Could we pay fewer teachers to oversee more students if it was remote work, remote learning? So I think that's a whole line of questioning all its own. That was one thought. Then these other three thoughts I think apply to either situation. One of the challenges that schools, employers, employees all have to think about that I think is becoming so apparent with the way everything's going right now is the tech and the infrastructure side of all this, because what people are realizing is that a lot of people are not well equipped at home to meet the modern tech demands of their jobs. Even we have had to go through with. I mean, I've gone through it with you, but I went through it with Caleb and JD, who are on the sports show that it's called True Sports that True Chat also produces. And some of our clients we've had to go through this with. A lot of them are remote already, so it's not the same challenge. But for the people that used to come in studio, they've had to make some adjustments. And we've realized when I was working with Caleb the other day, we realized that his internet service was pretty much right at the bare minimum of what was needed to be able to do what he was doing. And that's like, keep everybody off Netflix at home, don't let them do anything else, in order for me to hopefully, sit here and pray that the internet's okay while him and JD, do their show remotely. And it's not been all that different for you and I in some cases.
Right. And yet in our personal lives, our internet connection was fine. We were getting all the services we wanted. We could do anything we wanted. And we thought it was all, we were like, well, everything's fine. We're connecting quickly. We can take phone calls. We can do all the things that we normally did. And it's like, it was no big deal. But then when you start to say, oh, but you need this in order to do this show, or you need this in order to upload things to your virtual classroom, all of a sudden you realize, wow, what I have here at home really lags behind what I need.
What you have at work.
And
I mean,
so that's your point, and it's very well taken.
That's the big thing I think that employers and schools, everybody who employs somebody has to think about is a lot of times they've invested heavily in their physical infrastructure to enable people to do the work they need to do at the office. So it's not quite as simple. And I think that's what a lot of people are discovering, is just saying, well, we'll just send them home, because not everybody has what you're going to need at home. So there's also then the investment in getting people what they need at home, and our investment as a country in upgrading the physical infrastructure required to enable people to do what they need to do from home. The only other thought I had as you were talking, because I read this the other day, is what a benefit to the environment it has been to have all these stay-at-home orders. Kind of something that got lost in the noise. Maybe we'll do a show about it at some point. But they've talked about in just, the month or two that this has been going on, where a lot of people have been, staying home, major and sizable measurable drops in pollution around major metropolitan areas. So that's kind of an interesting side of all this too, when you talk about remote work,
cleaner air,
remote
because we're
learning.
not all driving.
So,
Yep. Well, and you can see, Well, and you see economically too, what's happened with gas prices, both for gasoline and crude oil prices, because nobody's out using it. But I will throw another one that you actually made me stop. I know that my daughter mentioned that she went to church online.
Oh,
the last couple of weeks. So what does it do? Churches have always offered that, but it's always been for, usually people who are stuck at home, who can't get out, or stuck in the nursing home, working with those parishioners that can't physically make it into church. But I wonder too what it will do as more people hook into that, so we can't meet in church, but it's online. How many people will that end of things grow, or will our need as humans to interact with one another inside of a 6-foot radius take over? And will we go back to all of these things? It will be an interesting situation in the next 4 to 6 months to see how this all plays out when we do finally come out on the other side of all this.
That it will be. As always, you can let us know your thoughts. You go to thestateofus.org. We've got the articles linked there, books that Lance and I are reading. We've got some exciting stuff coming up in the way of reading material. We've been doing a lot of behind-the-scenes stuff, so we're excited in the coming weeks, especially now. It's perfect time for you to go to the State of Us, pick up one of these books that Lance and I have been reading, get it delivered to your home, read, and see if you come to some of the same conclusions that we did. But we've talked about, Lance, right, that a big part of all of this, what I'm talking about right now, making the State of Us successful, is trying to accomplish that mission that we have. And what is that mission that all these shows on True Chat all are pursuing? We're a syndicated radio show. We're a podcast. There's a lot of different ways to tune in, and we need people to do that to accomplish our mission, right?
That is. And our mission here is to educate people by providing honest, open, and respectful conversations.
And so what are some of the ways that others could invite people to tune into the podcast version? Because this goes out on the weekends to our radio stations, but Tuesdays and Thursdays we've got new episodes. So if people wanted to tune in, how could they do that?
Well, anywhere they find their favorite podcast, whether that's Spotify, Stitcher, Apple Podcast, or some other app, we're there, and easy to find us. Or you can also go to truechat.org and find us in the State of Us. So lots of different ways.
For the State of Us on True Chat in Urbana, Ohio, I'm Justin T. Weller.
And I'm Lance Jackson.
Special thanks to our producer, Bradley Bush, for getting everything facilitated in this remote environment that we're working in. Thank you all for tuning in. We'll see you next time. Be the change. Be sure to check out our website, thestateofus.org, for books, articles, and all the ways to tune in. thestateofus.org.